Professional Identity, Part 2, Professional Communication and Conflict Management. You are about to step into professional nursing, and I want you to know this up front. Your clinical skills matter, but your communication skills will protect your patients, your team, and your license. We are going to talk about the real life communication moments new nurses face: speaking up, handling conflict, managing difficult families, setting boundaries, and knowing exactly when and how to escalate concerns. When you become an RN, your role changes. You are not just learning anymore, you are accountable and your voice carries weight. There will be moments when something feels off, and you will have to decide whether you stay quiet or speak up. I want you to hear this clearly. Communication is not a soft skill. Communication is patient safety. It is also how you protect yourself professionally, especially when situations are unclear, tense, or high risk. Speaking up to a physician can feel intimidating, especially when you are new. Hierarchy is real in healthcare, but so is your responsibility at the bedside. Your best tool is structure, because structure creates credibility. Use SBAR to communicate clearly and professionally. Instead of saying, "I'm worried," you say, "Here is what I'm seeing, here is what it means, and here is what I need." That is advocacy, not attitude. Here is what SBAR can sound like. Dr. Smith, I'm calling about Mr. Jones. Situation: his oxygen saturation is 88% on 4 liters, and his respiratory rate is now 30. Background: he was stable earlier today with SATs in the mid-90s. Assessment: he appears increasingly confused and is working harder to breathe. Recommendation: I need you to evaluate him at the bedside now, and I recommend we consider a rapid response if he continues to decline. That is professional nursing communication. That is how you get action. If you speak up and your concern is dismissed and you still believe the patient is unsafe, you escalate. You do not debate. You do not apologize for being thorough. You escalate through the chain of command, and you activate rapid response if criteria are met. The patient comes first. Your responsibility is not to keep the peace. Your responsibility is to keep the patient safe. Now let's talk about nurse-to-nurse conflict, because this can blindside new nurses. Eye-rolling, undermining comments, exclusion, public criticism, and disrespectful tone are not normal. They are unprofessional and they can erode team function and patient safety. Your goal is not to match energy. Your goal is to set a boundary calmly and clearly. Here are a few scripts you can keep in your back pocket. I'm open to feedback, but I'd like to discuss it privately. That comment felt dismissive. I need respectful communication. I'm willing to talk about the issue, but I'm not willing to engage in personal attacks. If the behavior becomes a pattern, document objectively and involve leadership. Patterns matter, and you are not expected to manage repeated hostility alone. Families can be frightened, exhausted, and overwhelmed. Sometimes fear shows up as anger. Your job is to regulate the room and return the focus to safe care. Start with acknowledgement and curiosity. I can see this is upsetting. Tell me what you're most concerned about. Validate emotion without agreeing to unsafe demands. I hear how worried you are. Let's review what we can safely do right now. If the situation escalates, involve your charge nurse and plan a structured family meeting. You should not carry high conflict alone. One of the fastest paths to burnout is being the nurse who always says yes. Boundaries are not selfish. Boundaries are professional. You can say, "I can help after I finish this med pass," or "I'm managing my own assignment right now, but I can assist in an emergency." Clear boundaries protect your workload, your focus, and your safety. Healthy teams respect boundaries. You must know your hospital's escalation criteria and rapid response triggers, but I also want you to trust your clinical judgment. If you have a sense that something is off, reassess and escalate early. A patient can be deteriorating even when the numbers look okay. Your worry is data. Early escalation prevents codes, prevents harm, and saves lives. When you are escalating concerns, documentation should be clear, factual, and timely. Document what you observed, your assessment findings, who you notified, what the response was, and what you did next. Documentation is not about covering yourself. It is about telling the truth of the patient's story and showing your clinical reasoning and advocacy. Conflict is part of healthcare. Your goal is not to avoid it. Your goal is to manage it professionally. Ask yourself, what protects the patient, what supports the team, and what protects my integrity? Use active listening, clarify what you heard, speak directly without blame, and return to the shared goal of safe patient care. Confidence does not come first. Action comes first. Then confidence follows. Practice your communication scripts before you need them. Learn the escalation pathway on your unit. Find a mentor who communicates well and reflect after hard moments so you learn quickly. You earned your place in this profession and your voice belongs in the room. As a new nurse, your communication will shape outcomes. You will prevent errors. You will catch deterioration early. You will protect patients from harm. You will protect yourself from burnout. Be the nurse who speaks up. Be the nurse who sets boundaries. Be the nurse who advocates without apology. We need your voice, and I'm cheering you on as you transition into practice.